Good afternoon, everybody. We're going to give it about, oh, no one's here yet. All right, people are coming in. We're going to give it about 1 minute to let everybody come in. Thank you for joining us. We have a large group attending today, so we're going to give everybody a little bit of time to attend. Again, thank you, everybody, for joining us. We're going to take a minute or 30 seconds to let people get in. Let me see how the room looks. Great. People are still coming in. All right, well, I'll kick off with a couple intro slides to get things started. Again, welcome everyone to Leveraging Technology to Enhance Patient Experience. Please feel free to introduce yourself in the chats and keep us on time today, or we're going to jump right in. My name is Matt Beyerschmidt. I use he, him pronouns, and I am the Assistant Director of Training Technical Assistance at the National Nurse-Led Care Consortium. And some technical assistance and housekeeping. Many folks are familiar with the Zoom, but we're in a webinar today, which means all of your cameras and audio are turned off. We encourage participation in the chat and Q&A box, as well as the reactions button and emojis. I remind you of the keyboard shutoff shortcuts for each, as well as the options to turn on closed captions. For any access needs, please message me, Elena, Kyranisha, any of the hosts or panelists if you have any questions in the chat, and we'll reach out to you directly. Slides will be shared in the chat for those who need to do better following along. The recording and slides will be shared in the follow-up email via Zoom within 1 week of today, and we will post them on our shared websites as well. And lastly, we will have a transcript for the session available by request. This is the National Learning Series. It's sponsored by the Health Resources and Services Administration, or HRSA. This task force dives into issues related to HIV, diabetes, chronic comorbid disease management, and that all impact population health management. For more information about the Community Health Management Task Force, visit our website, and we'll drop the link in the chat. It's Community Health Task Force, and will also be shared at the end. This is the Population Health Management Task Force members. We want to briefly acknowledge the 12 National and Training Technical Assistance Partners, or NTAPs, who support this and other sessions in the series. You can read more about each of these partners at our shared website. This webinar is a part of a 4-part Community Health Service Management Task Force National Learning Series. To see the recordings and resources from the other webinars we've had, feel free to visit, again, the website of Community Health Management Task Force. And I'm going to copy that link if nobody's dropped it in the chat yet, and I can do that. Here is the website that you can find that on. And then the next slide. Again, this is our conference of interest. We have no real or perceived vested interest that relate to the presentation, nor do we have any relationship with the pharmaceutical companies, biomedical device manufacturers, and or the other corporations whose products or services are related to pertinent therapeutic areas. These are the agenda today is the facilitator and moderator introductions, which we'll be doing after this. I'll be doing some grounding and go over the learning objectives, and then we will do guest speaker introductions and the facilitated discussion, and we will leave time at the end for Q&A. Quick shout out to our moderators and organizers. We have Elena Boyer, PhD, from the Senior Director of Programs at the National Healthcare for the Homeless Council. We have Aba Anison Amu, Senior Program Manager at Health Outreach Partners. Myself, I'm Matt Beyerschmidt, the Assistant Director of Training and Technical Assistance at the National Nurse-Led Care Consortium, and Kyranisha Coleman, the Program Director at NPH Salud. Thank you all for your hard work on this. And I'm going to now go over the learning objectives and some level setting slides. Today's learning objectives are to understand how technology is reshaping provider-patient communications, identify digital tools to enhance the patient experience and care team performance, and explore strategies and opportunities for implementing tech-enabled workflows. Regarding technology and the patient experience, some level setting. Chronic disease management requires ongoing communication, follow-up, and care coordination. Health centers increasingly rely on digital tools to support the patient engagement between visits, and technology can help care beyond the clinic through patient portals and messaging, telehealth and virtual visits, and two-way texting and outreach tools. When these are used effectively, technology can access communication and continuity of care. Opportunities and considerations to think about. Technology can support health centers by improving communication with patients, strengthening team-based care coordination, supporting community health management, and reducing some administrative burden. At the same time, health centers must consider the digital literacy and access of the community, workflow and integration for the staff, maintaining trust and human connection, and managing the increased digital communication that may come along with using these tools. The perspectives that we are exploring today, we have Serene Garcia, the Chief Impact Officer of the Finger Lakes Community Health. She'll be touching on expanding access through telehealth, digital engagement, using technology to support medically underserved and rural populations, and integrating technology into patient-directed care delivery. And we also have Jen Callahan from Health Talk AI, designing, and she'll speak on design technology-enabled care models, using digital tools and automation to improve workflows, and helping organizations scale patient communications and coordination. And when I say talk about, I mean, those questions for them will be geared around those topics. And I'm going to now kick it over to Alina. Alina, thank you for kicking it off, and good luck, everybody.
Thank you. Thank you so much, Matt, for that introduction and grounding. Welcome, everybody, to this great session today. As Matt said, the last in the 4-part series, so we're glad to have you here today. I am going to be facilitating the questions with our speakers, and we will have a time at the end, about 10 minutes, to be able to get questions from the audience. So please be thinking about questions to put into the chat or the Q&A box, and we'll make sure we get to them during that time. But now I'm going to take just a few minutes to introduce each speaker and then give them a few minutes to talk about their program more broadly. So our first speaker I'd like to introduce, and really want to thank both of them for their time, is Serene Garcia, who is the Chief Impact Officer at the Finger Lakes Community Health Center. And Serene leads the innovative strategies to expand access to high quality healthcare with more than 2 decades of experience at her community health center. Serene has had a range of leadership and programmatic roles, including community health worker, migrant voucher program coordinator, director of special programs, and administrative leadership. She's also worked in the telehealth field since 2010, playing a pivotal role in building partnerships and leveraging technology to improve healthcare delivery for underserved populations across New York State. Serene brings a bilingual, bicultural perspective to her work and holds a Master of Science in Management. Her focus includes healthcare innovation, access to care, telehealth expansion, and community-centered solutions. Serene, would you like to talk a few minutes about your program? And then I'll introduce Jen.
Great. Thank you for having me. Hello, everyone. I am in New York, but not New York City. We're actually 6 hours or so away from New York City in the beautiful Finger Lakes region, wine country, although it's starting to also be very much beer country. So if you ever want to come visit this way, it's beautiful in the spring and summer. So yes, we have health centers scattered throughout the Finger Lakes region, and we do have the beautiful lakes around us. So you have to go around the lakes to get to the different sites. So very rural. We provide medical, dental, behavioral health services, and we work in the agricultural setting as well, go into the farms and provide services there. We have a very robust program for our school-based health centers and our portable dental program. Transportation continues to be hard here in our areas, as does internet access and technology access. So we'll touch base on how do we address that, as well as getting into the major cities for tertiary care. We have a large Mennonite and Amish population, so we may not have heavy traffic in regards to vehicles, but if you get behind a horse and buggy, that's traffic for you to maybe have a slower ride into work. So looking forward to having some more discussion around how do we support our patients in our area.
Wonderful. Thank you. And so looking forward to your perspective from just the diversity within where you sit. And I will take now to turn to Jen Callahan. Next slide, please, to introduce her and give her a few minutes to talk about her program. So Jen Callahan is the Chief Operating Officer at Health Talk AI. She is a nurse and nationally recognized healthcare consultant who brings her expertise in transformational initiatives, including development of complex care delivery models, value-based care optimization, and the strategic design of network-based delivery systems and high-performing network models, including ACOs, MCOs, IPAs, PCAs, and HCCNs. A lot of acronyms there, so we're happy to kind of put those in the chat for you. Um, at Health Talk AI, Jen leads operations, implementation, and client success, helping organizations achieve operational excellence through innovation and intelligent automation. Her focus is on driving scalable, sustainable transformation that delivers measurable impact for healthcare organizations and the patients they serve. Jen, would you like to get off mute and share about your program?
Yeah, good afternoon, everybody. Thank you so much for having me. I feel like there are a lot of acronyms there, so I apologize for that. That's just an alphabet soup. But that's kind of healthcare in general, I suppose. So at Health Talk AI, we work, I would say probably about 80% of the work that we do is serving organizations that serve rural and underserved communities. So the work that we do is partnering predominantly with federally qualified health centers, rural health clinics, or lookalikes, and which is great selfishly for me because the 10 or so years that I spent prior to joining Health Talk as a consultant was in that exact same space, which so it's a definite soft spot in my heart and something that I love doing. So it allowed me to kind of have a continuation of that work. And it also, I think, is really important because, as we know, resources are slim, margins are tight, the workforce is constrained, and efficiency is even more important than ever. So being able to bring tools that allow that workforce to kind of be extended through innovation and technology and have tools brought to their fingertips that are simple and user-friendly, and also bring those tools to patients and be able to bridge the gap of communication and do it in a way that really enhances the patient experience and at the same time decreases the administrative burden for providers and their staff, and really just enhances the overall experience. That's really what we're all about. That's the kind of core idea behind our strategy. And myself and my team are really dedicated to getting those tools into the hands of the clinicians and their support teams, and into the hands of patients. So very excited to be with y'all today. Thank you for having me. And our teams are all across the U.S. I physically am located in San Antonio, but my team, I have team members all across the U.S. Our company is actually, our headquarters is just outside of D.C., but we are all over the U.S. So it's really exciting to be able to work with organizations in every shape and size and all different demographics, which is awesome.
Thank you. Wonderful. I'm so excited to get more information from both of our speakers today. As Matt set this up, we really do hope, and you can tell from their introductions, that we're trying to provide two different perspectives of how technology enters our spaces. So, from the operational sides that Jen can provide and the health center performance, as well as what does it look like in the direct patient support and those direct care spaces as well. So, really hoping to get both perspectives. I know that I, for myself, as a patient, as maybe many of us are, I certainly have the app to my healthcare and my doctors, and everything on my cell phone as well. So you can also come to this space kind of thinking about that experience for yourself. But let's go ahead and get started. And Matt, I guess we can take the slides down, I guess, while we go through our facilitated questions. I'm happy with whatever makes sense. But I want to get started with really, Serene, with you a little bit, talking about, again, from that community health worker perspective, patient navigation, support services, and really talk about how has technology supported your work in building trust with patients. I see technology really needing individuals that interact with it a level of trust. Okay, I'm communicating now about my healthcare through this technology platform. So how do you build trust, especially around those who may be hesitant to engage with the healthcare system?
Yes. So first for us, we really need to make sure that our staff and our clinical team are comfortable with the use of the technology. So when we first started using video conferencing technology or the patient portal, we had to make sure that our staff were comfortable with it. So if you were to walk into our health center today and go into any clinical space, so whether it's medical, dental, or behavioral health, there is video conferencing technology there. And the technology is not only for video conferencing. So it's not only to speak to a provider or an interpreter. It's also used so that the provider can show you your x-rays or show you a app or a website for you to get on to learn more about different things. So we try to use the technology and have it right there in front of everybody's face, in front of our staff's face, in front of our patients' space, so that people feel comfortable utilizing it and are able to ask questions. So the monitors are pretty big. They're 32-inch monitors. They're touchscreen monitors, so it's multifunctional. We're able to use it for digital signage. We're able to use it for soothing, calming sounds. Instead of having those noisemakers in the background, you have the ocean waves on the screen. So when you walk in, you have that. Very effective in the dental side and in the behavioral health side. Um, so it helps to start building that conversation with our patients. It also helps with our staff to do those soft handoffs if a patient is on the medical side and they are interested in counseling or are suicidal or want to do a soft handoff to behavioral health. They can call in a behavioral health provider via video. So you have that confidentiality versus having the behavioral health person walk in the room. They can do it via video, or call in an interpreter, or call in a third party member via video. If you don't want to call my spouse or a family member, you're able to do those pieces. So it really becomes the opportunity to include other people.
Mm.
Also, you're able to use the equipment to bring in your specialists. So we're in rural areas, so we're able to have our patients come to our health centers. We collaborate with third-party providers, and the patient comes to our health centers. We telepresent to that third-party provider and help facilitate the visit. So our patients really do feel comfortable in our spaces. But it first really starts with our staff feeling comfortable in using the equipment so that then they can help the patient also feel comfortable using the space and really showing them that it is easy to use or have that comfort level, knowing where they can get the equipment or how they can access it in the different areas. Whether it's getting a laptop or a hotspot, their local library, or how they can use it. If the clinical teams say, well, we're going to try using this technology, but I'm not sure how it's going to work. We'll see if it works okay. the patient's going to be like, okay, if you're not sure about it, I'm not sure about it. Whereas if you're saying, yep, this is going to work, we're going to do great, it's going to be perfect, the patient's going to be more likely to feel more comfortable in using it as well.
That's a great thought around that. I just kind of slowly integrate it into their environment and when they come to a visit and kind of getting familiar with it being present for check-in purposes and then knowing its purposes or how to use it and how it can engage with other supportive services. So I really like that approach where it's more of an ease in as opposed to we're going to this app and now you have to download it and we'll see you, next time. So really appreciate that. I can imagine how that builds trust. And I do want to get to how the training is for that from Jen's perspective. But before I do that, I just wanted to ask a follow-up question to you, Serene. For community health workers and patient navigators, what are the digital tools that have been most effective in supporting care transitions and follow-up and linkages to community resources?
Yeah, so what I talked about earlier, that's inner health centers. For community health workers, they have in a so think of a computer bag. They have digital otoscope and stethoscopes and their laptops. And nowadays, the digital scopes are USB connections with their hotspots. They're able to go out in the community and use those digital scopes. They're trained on how to use them. And if they go do a home visit, they find a patient that has a lesion or not feeling well, they're able to call into the health center, do a video call, use the digital scope, show the patient how to use them, and have a telehealth visit, or have the patient get on their patient portal, get on the website, set up a call, um, request an appointment. So the patient navigator, the community health workers, they're showing the patients through their own technology how to place their call. So they're empowering them to be able to do it themselves. And the community health worker also has technology to be able to facilitate visits. And sometimes it means having to get into the car and drive a mile up the hill where there's better internet and do a call that way so that they can then look inside the ear or hear the heart or things like that. So the staff do get trained as well on how to use the technology and how to support the patient in using it and putting the otoscope in their ears.
Wow, that's really helpful. I didn't even know that it can get to that level of how to use devices through the technology too. So I appreciate that, and I think this really leans in very well to reach asking Jen some questions, as I know that it sounds like from your program, you're doing a lot of training to this staff on how to do exactly kind of what Serene was sharing in supporting the patients. And so, if you would like a minute to reflect or, actually, the first question I have for you kind of reflects on what Serene said. And so I'll start with that is how has your program or company supported for front desk and administrative teams in adapting technology and improves patient communication and reduces scheduling or intake bottlenecks?
It's a great one. And I want to just first just say to Serene, congratulations on all of that work, because I know it's not easy. That's a lot to implement all that, and just to get all of that buy-in and to momentum is a lot. So congratulations on that. So something that we've really focused on and continue to kind of continually work to improve. We kind of and part of this is because I really believe in it wholeheartedly. Maybe it's some of my nurse brain, once a nurse, always a nurse, maybe. But also just from you can kind of never take the consultant hat off. But just the model of continuous improvement and trying to work with our clients to maintain that same kind of methodology and mindset. And I always share with our clients that anytime you're working with any vendor, if it's kind of a drop and run technology, that should be a big red flag, right? That there should be a partnership and they should constantly be evolving with you, because the work isn't static, right? Like it's constantly evolving. So we've seen some really great success with not just with our health center and rural health clinic, partners, but hospital partners, really regardless of the environment, just the healthcare ecosystem as a whole, as it relates to kind of some of that front desk or, administrative operations workflows. It really kind of starts with, we have this kind of tendency to put things in buckets of three. And so our bucket of three is innovate, automate, and activate. So leveraging innovation to automate the things that can be automated safely and appropriately, to activate patients, to be able to, allow them to engage and to be activated as, an active participant in their own care at the level that is comfortable to them. And I heard you use the word, Serene, empower, right? So empowering them to be able to do the things that they're able to do, and optimize their ability to be activated. And so that's kind of our strategy. And so that strategy leverages our tool, but really there's so many tools that can be leveraged, right? To use that innovation through the digital technology space and I think especially right now using things like agentic AI, there's so many different ways to leverage that, and realizing that not all AI is created equally, and that there is a lot of really safe, effective ways to use AI, and we should be leaning into that, and really investigating what that looks like and how our patients can benefit from it. And we don't need to be talking about, having AI make clinical decisions, but how can it help us automate administrative processes and lighten the load and decrease administrative burden and do things that are safe and appropriate, to automate some of those very task heavy duties and responsibilities, things like multilingual patient communication and outreach, appointment reminders, intake workflows you specifically mentioned. There's ways that we can link specific document delivery to patients based on an appointment type or a cadence, so that a patient isn't going to just be inundated with work to do, and documents to fill out and paperwork every single time, but rather using that smart technology to be able to discern, did you just fill this out 2 weeks ago? And this is really a document that only needs to be filled out once a year. So we're going to hold that one back because you just did that one. And really, if it's something that you only need to fill out when you are coming in for a certain type of appointment, we're going to recognize what type of appointment you're here for. Different things where we can really leverage the technology to be able to scrub the schedule and scrub the data and use it as a way to improve the patient experience. And also the experience for the staff. So whether it's, delivering the patient's PHQ-9, or a social determinants of health, which I know that's not the words that we're supposed to be using, social drivers of health. And so, whatever screeners we can provide to patients, and deliver them to them in a way that promotes self-disclosure. And, rather than maybe in an environment that is less confidential because we're constrained by space, or in a phone call where perhaps they're not in a space where they can share information as freely, or, there's just so many different really great tidbits of research out there that tell us that leveraging technology actually allows patients a little bit more autonomy and promotes self-disclosure. So, how can we support that? And also decrease the workload for staff at the same time. So helping in that way, helping to reduce overall call volume, because if we can decrease the amount of questions that patients have, because we're creating a more clear-cut, simplified experience. The scheduling gets easier if we can, allow for self-scheduling. We can empower patients through the ability to cancel or reschedule if something needs to be done, to modify something that's already been scheduled, minimize the scheduling gaps. There's so many different things that puts some of that power back into the patient's hands through the technology. Our platform specifically is appless, so patients don't have to actually download anything, which is very simple for them to use. And it actually, for patients kind of throughout the lifespan, right? So no matter their age or level of comfort with technology, it's very simple for them to use. And we've found that to be very effective. And in terms of kind of the training and things like that with staff, that is something that we do continually. We have everything set up in a phased approach. So initially during implementation, we have weekly touch points, and there's a lot of interaction and a lot of training. We kind of treat it like a transformational activity. It's really change management 101, right? There's a lot of kind of evidence-based guidelines that we follow that really kind of harken back to just change management, and really kind of garnering that buy-in, which I'm sure Serene is very familiar with since she's gone through all these different iterations. And then once we are in phase 2, where it's really just scaling your implementation across your organization, our interactions move to bi-weekly. And then once you're fully implemented and you're in optimization mode, we meet monthly. So it's all about just sustaining your optimal workflows and helping your staff. But the optimization is about that continuous kind of improvement and making sure that the technology evolves as your workflows evolve and your needs evolve.
Wow. I mean, thank you. It sounds like there's a lot of flexibility in the tool that you use to allow for changes and update, because healthcare is it's a learning healthcare system. That's what we are. And so we're always
Absolutely.
developing. And I definitely appreciate the comment about how that's really supportive of a lot of seniors who might have difficulty understanding technology. I know I'm starting to get to a phase where I'm like, starting to need to, just ask for some help. But I really appreciate both of you talking about how important it is for the patient experience and making it about their interactions with technology and having autonomy to their own healthcare. So a lot of times, and for a long time, I'm a community-based researcher at heart and community-based researcher at heart, and we talk to our patients about you are the controller of your own health, and being able to have that interaction when you need to, or with a doctor or your healthcare system or healthcare coordination, really kind of hopefully puts a lot of the power and autonomy back into their hands. Because I know certainly there's situations where people might be having experiences, but they don't have an appointment until days down the line. But I need to record that this is happening in real time so I don't forget to relay that information. So I really appreciate that interaction and kind of uplifting that technology doesn't have to be something that's scary or challenging, but can really be your ally as a patient in terms of your patient-focused communication with your care team. So I was taking notes over here. So that was really great. I appreciate that. But one of the things that it do and Serene, I'll go back to you for a little bit. A follow-up question I have for you is, are there any models that emphasize evidence-based community health workflows? And if so, how has technology enhanced or complicated the community health worker-patient relationship?
Yeah, so for us, we are patient-centered medical home certified. So we have our community health workers integrated into our healthcare systems. We do the huddles, and they're embedded into the care team. And we have found that having the technology in our systems, especially the capabilities of doing telehealth, has enabled our staff, just like Jen's saying, to allow us to be able to do more with the limited resources that we have. So we are able to provide access to care to patients in a more broader space. It's easier for us to pick up patients, pick up 3, 4 people, bring them to our health center where we have medical, dental, and behavioral health, bring them to the health center, and they can go to the reception area and check in for whatever it is they're being seen, rather than picking up those 4 people, taking them to a specialist office. And then there's the concern of HIPAA because we're all going to the same specialist. So we must all have the same concern or the same problem. And it's easier for us to bring them to our health center than have them go into the back room and be seen for potentially the same thing, but they're not going to know because we're in the back room and through a video call, we're able to be seen for something else. Or just be able to reduce the amount of travel time into the spacing. So some of our health centers, it's an hour and a half one way to get to a space. So traditional care, you go take our teledental program. We have a pediatric teledental program. We have general dentists in our health centers. And if they come across a child that's 4 years old and needs quadrant work, they need to get a root canal, or they have quite a bit of dental work that needs to be done. They send them to a dentist. It's a pediatric dentist. It's like an hour and a half. I think our nearest health center maybe is 45 minutes one way. So they have to travel to the dentist to do their clinical setup, right, to determine what needs to be done and make a clinical plan to see what needs to happen. Then they go back home. Then once they make the plan, they go back maybe for if they have to go to the operating room, nitrous oxide, general anesthesia, whatever it is, they have to go back, do the pre-surgery visit, go back home, then they go back to actually get the work done. Well, we've been doing that program since 2010 via video, where the patient comes back to our health center. They do the pre-visit in our health center through a digital oral camera. We provide the x-rays. They examine the patient in the health center. They're assessing how the child is doing to determine if it's nitrous oxide, general anesthesia, what kind of care is needed. And then they come back into our health center, see our provider, do the physical examination, and they only go to Rochester just to get the care done. So they make that 1 hour and a half trip once, and that's 1 hour and a half one way to get the work done and then come back home, versus having to do it a couple of times. So that reduces the amount of time that we have to allocate our community health workers for that one-on-one visit. They're able to really allocate their time to provide more services to more people because we're more efficient with the time that we use, and how they're able to work with our patients because they're able to come in closer to our health centers. So we're able to replicate that with a variety of different services, whether it's HIV care, Hep C care, or psychiatric care, whatever type of services that are farther out from our health centers. Our staff are able to really work closer by using the technology that's available to them and leveraging those resources. So between the technology, the EMR systems, the systems that help them identify what social determinants of health they have, or just checking those quality metrics, if they got their foot checks or if they got the different components that need to be done and taken care of, whether they have health insurance or not, those panel levels that are able to really look at in a glance how an individual is doing before they touch the patient. They're able to really say, okay, look, Serene is doing well, or nope, she hasn't had her PAP, she hasn't had this, she hasn't had that. I'll make sure that gets addressed and taken care of. It really enhances the work that the community health worker is able to do and to support the patient to get the care and meet them where they're at. What's important to you right now? How can I help you get there? And at the same time, provide the support to the provider to say, okay, well, this is what's priority to them right now. It's housing or it's food
Mhm.
insecurity or whatnot. So the between the technology, the EMR systems, the data that's available to them, and meeting the needs of both provider and patient really helps to bring everybody together. But it really does take the community health worker and the team coming together
Mhm.
to do all of that work, because you can have the technology and you can have the clinical team, but somebody needs to be driving the team together.
Yeah. No, I appreciate you brought up so many things that I know present as barriers to a lot of patients, particularly the population that my organization focuses on are people experiencing homelessness. And there's so many competing priorities, and health is not always the highest. And so when people have to constantly go different places or go back because it's not coordinated,
Mhm.
we really lose that patient to care. So I can see a really important role in how technology is supporting community health workers in coordinating that care, making sure it's tailored to the needs of that care at that time for that patient. And then on the other side, I think about it. When we talk about staff well-being, it kind of can lift a little bit of that workload, and working with community health workers and case managers, their caseloads can be really high. So I think I'm hearing that it can also help improve those things as well. So, well, wonderful. Well, thank you so much. I think I want to go back to I'll go back to Jen for a question for you. Um, how do you ensure that the frontline staff feel confident and supported when using technologies, when new technologies are introduced into the daily workflows? And I feel like you kind of talked to this a little bit in that the programmer app that you have can be adapted as things change too. So I don't know if you want to share a little bit about that.
Yeah, absolutely. So we take a lot of extra care and a lot of extra effort to make sure that um, frontline staff are very comfortable. We kind of use and maybe this is again this is nurse brain that comes into effect, but it's kind of a I do, we do, you do idea in the training. So before we turn over the reins to kind of the back end of the system, the console, I guess, if you will, we do kind of all of that initial build and configuration and everything. But the folks that are going to be intricately involved in that, we have them really involved in kind of sharing with us what's meaningful to them and how it will be incorporated into their existing workflow. Because I think we all have been victim at one time or another of maybe it's the very best technology that money can buy, but if it's plunked down into your workflow and it's not meaningfully integrated in and woven into your workflow, we will find a way to work around it.
Mm.
And we all know that there's truth in that. So to in an abundance of caution, to make sure that that doesn't happen, we want to make sure that the technology is meaningfully integrated and woven into the existing workflows. So, and also, give the staff an opportunity to really assess their current workflow and say, this is our current state, but should it be, right? Is this our ideal state? And kind of use it as an opportunity to make some perfecting modifications and be partners in that. So they are really the drivers. We're kind of in the passenger seat, but we are, we're really the co-pilot. So so we work very closely with them and make sure that the way that the system is configured is very supportive of the workflow that it will be used in and within, because otherwise it feels like something extra for them to do. And that is never the intent, right? The intent is for it to enhance their work, to make their work more simple, to make it feel easier and less burdened, and to really, make their whole duties and responsibilities feel lighter, for that administrative burden to feel lightened. And if we haven't done that, then we've missed the mark. So we really work very, very closely with them. We have to do a lot of learning first. So we do a whole lot of listening before we do too much talking. There's a lot of asking, and they are, they're teaching us before we're teaching them, I guess would be kind of a good way to answer it. So then we start incorporating in to their workflows. And then the training, is, part of it is real time, in the moment, boots on the ground training. Most of it is remote, of course, but I mean, it's really in the mix, in the fray of, patient flow. And, we do it in the sandbox, and then we do it, in production. And we get into the mix of, how can we make this easier for you? We'll try some things for short duration, and then we'll kind of do an assessment of what went well and what didn't go well. And we'll fine tune the things that they feel like didn't go well. They didn't get the intended outcome that they were looking for. We get patient feedback as well. So we really encourage them to involve their patients in the process. And then we really, really work hard, as I mentioned, to really keep them engaged throughout those phases of implementation. And then as we are continuously rolling out, new versions of our technology, we have large scale education and training that go on all the time. And then all of our education and training is recorded. So we also have an on-demand education kind of, just suite of tools and resources that our clients can get to anytime. They can download printed materials and have them to, print and hold if they are people that like paper. They can have digital resources if that's preferred. There's webinars that they can watch. So everything is really intended to make things as easy as possible, and available at any time of day or night. Understanding that, people's lives are busy, and it's not something, not everything is meant for a lunch and learn.
Yeah. Yeah, no, exactly. Small tidbits of, learning is really helpful ways to have some micro learning. I want to ask you one more question, and then to Jen. And I apologize because I skipped over this, but I do want to relate technology to chronic disease management.
Yeah.
And I just, would love to ask Jen what your experience with the technology and chronic disease management, and Serene, if you have some examples of how you've seen it work in diabetes care, or whatever chronic condition, um, please feel free. So Jen, do you want to get it started on that question?
Yeah. Oh, I love this one. So I could get really geeky and nerdy about this. So this is one of the facets of the tool that I think is really exciting. We have actually what we call care paths. And so there's a number of different ways that care coordination and care management can be done. There's lots of different outreach and reminders, reminding folks of care gaps, and then, taking them through, branching logic type interactions and conversational logic, and then, routing them to ultimately landing at let's get you scheduled for whatever that may be. But elevating that to chronic care management, being kind of a next level experience, is, using diagnosis-based or risk stratification-based data to identify a population of patients that need a different level of touch. And so we have these care paths, that take the patients through a very coordinated level of outreach that is built out based on their level of risk. So we have low to moderate risk care paths, and then we have moderate to high risk care paths. And we have about 100 different care paths filled out for all different diagnoses that range from, maybe we have set it and forget it care paths for our low risk diabetes or hypertension folks that just need a reminder once a month, like, just some education. And it's just to remind them about good habits and little tidbits of information. And then we have folks that need something once a week, or maybe even multiple times a week, because they're going through a transition of care. And it may be very high touch for a month or 3 months, and then taper off for another month or 3 months. And it's very specific. And the beauty of the way that these are configured, and I saw that somebody had asked about how we use the human-centered design. And so this
Yes.
this is really kind of part of that. And it's very intentional around real world use cases, real world workflows, and decreasing some of the complexity around reaching patients that are hard to reach, and making it easier to communicate with these patients. And so everything, although we're leveraging the technology to do a lot of the interacting with patients, because it's protocol based, there's built-in escalations, red flags and escalations. So if patients respond in a certain way, it will escalate to, your care manager, or, if that's not a nurse, maybe specifically to a nurse, or to the provider, or to a community health worker, or, based on your team construct. Every team is constructed a little bit differently. So, whoever would be the right person, if they report that, they're experiencing, they've experienced now food insecurity, it may go to, somebody that is in social services that would be able to help them. So everything is on the back end based on all of the different potential responses. It's built within your organization. Each response has an intended recipient, and it's somebody that can actually mitigate that risk and respond to that patient for specifically that reason. If a patient responds with a specific blood sugar above or below a certain threshold, it will elevate that response, a blood pressure, whatever. So these are all patient-reported outcomes, patient-reported data. It's not automatically transmitting. This is not remote patient monitoring. This is interacting directly with the patient. But you think about, we have these types of things. We have care paths for prenatal care. So interacting with a pregnant mom who may be at risk, just checking in regularly. You may be able to catch, a safety risk or something going on that, again, maybe some self-disclosure that she may not feel safe reporting in the office, or, there's just an opportunity to make sure that patients are safer, have better outcomes, are communicating more proactively. And the goal is to absolutely have the very best outcomes possible. And so we have really intentionally and carefully built, and designed the tool to be culturally competent. It can be, it can interact with patients in any written language. So it translates into any written language. It's all, the way that the system is built is, it's very conversational, and very personalized. But it's also, as I mentioned, it's built on protocols. So, your providers can rest at ease that there are those kind of red flag escalation points to where, if something comes up, it's the technology says, this is where a human is needed. And the whole idea around the program is to be able to be a workforce extender and a capacity builder, so that we can take off the plate the things that are appropriate and safe to take off the plate by using technology and
Mhm.
free up the humans to do the things that only humans can do because they have limited time and opportunity. We have limited humans, right? Our healthcare professionals are in limited supply. So we want them to be able to we want to use them to the peak of their scope. We want them to be able to use their time to do the things that only they can do. And that's the whole idea around the care paths is in care management, in chronic care management, keeping in close contact with the patients continuously, decreasing their risk, but escalating the things to the care managers and to the care management team whenever the need is there. So
Excellent.
really exciting things happening on that front.
That's wonderful. And folks who are more interested, email addresses are on the slide deck, so you can reach out to Jen and Serene. But Serene, I want to give you the opportunity to talk about how you've seen chronic management. And I think there's a question here too, and it might be directed at either one of you. But Serene, I wanted to give you the opportunity to kind of share, how you're seeing management of chronic diseases and technology work from your perspective.
Yeah, so we have remote home monitoring in our health center. So for diabetes and hypertension, they're wearable devices. So they put them on and it sends the data to our clinical team within their parameters. I've seen it, it really works wonders. It's almost like going to the gym. If someone's monitoring you and you know you're accountable for it, then the people team seem to really do well with it. So they get on a plan depending if it's like Jen was saying, if it's a transition of cares, or they're on there for 3 months, 6 months, they for their blood pressure check, whatnot. And then they're seeing their nutritionist, they're seeing the nurse as well. And they've done wonders with people, and they're on the program. Then they keep their glucometers if they choose to, and they can continue to use it and put the information on in their patient portal, and it's there for the provider to look at. But they don't need to stay on the program once they get to where they need to be. But it really does help the patient get engaged and be proactive in the care that they are looking to do. So it does seem to that accountability, I think, is really what helps our patients really get the help that they need. Um, and especially within our areas, depending as to where they are and where they do their shopping, our staff sometimes have to go with them and go to the general store or the wherever and say, well, this is good for you to eat, this is not good for you to eat, because depending on where they're shopping, they might be getting things that are not necessarily as healthy as one would think they are. So the technology really does help just promote that health and well-being, and knowing that there is that support and available to you, whether you're putting the data directly into your patient portal or the technology is forwarding that information directly to the patient portal.
That's really helpful. And it sounds like, just to respond to the question in the chat, it sounds like a lot of the outreach, or the CHW does a lot of excuse me, the community health worker does a lot of the outreach for these types of chronic disease management and technology, or kind of is that interaction if needed. Is
Yeah,
kind of,
it's twofold. Yep. So we have community health workers, and I've used patient navigator. So patient navigator is a community health worker, but they stay in the health center,
okay.
and they support the provider in the health center, and they also do outreach through the health center and collaborating with our community partners and our community health center or community. Health workers are out in the field, and they are doing a lot of driving and transportation and out and about. But we found the need to separate the or at least identify people to stay in the health center and people to be out in the field, because there is a need for that support team in the health center to provide additional support for people that need that connection with other community partners, whether it's for pharmacy or other services that the nursing team and the clinical team can't do. So we have folks in that stay in the health center to do those services as well.
Wonderful. Well, we are right at time. I want to thank both of you all for joining. There was one more question. I'm going to read it, but I'm hoping that Debbie can connect with Serene. It looks like a question for you at some point. And we'll have the email addresses. But the question, and then I'm going to toss it back to you, Matt. The question that was entered was, how did the speakers change their strategies to meet an FQHC/health center needs when their community is very rural with unreliable internet access and limited access to transportation, clinical specialists, and others? So I think that's a question that's there. I know we're out of time and I need to hand it back to Matt, but I do encourage those who have questions to reach out to Jen and Serene. Um, Matt, thank you again so much.
Thank you, everyone, for your participation and this great question and answer we just had happen. For more information about the Community Health Center National Learning Series, again, please visit our site. I dropped it in the chat earlier on, and feel free to contact our NTAP collaborating partners and speakers from today's webinar. And their emails are here, and also you can scan the URL code, I believe, to go to the Learning Series webpage. And at the end of this webinar, please complete our evaluation form. Your feedback is greatly appreciated. And this is the disclosure, which I don't think don't really need to go over, but all this work has been supported by the Human Resources and Service Administration. And again, thank you all for joining us. And please keep an eye out for a follow-up email where you'll be receiving the slides, a link to the recordings, and all the relevant information you have heard about today. So thank you again, Jen and Serene. This is a great session. It flew by. And thank you everyone for joining us, and have a great rest of your day.
Thank you.
Thank you.